hostility or aggressiveness at home, and verbal aggression among obese patients with metabolic syndrome or type 2 diabetes mellitus, considering body mass index, anxiety, depression, and alexithymia. Adverse environment with poverty, low levels of socioeconomic status, and formal education can promote aggressiveness at home and social and verbal aggression since infancy and adolescence. It has been less studied at midlife. Many tasks are expected for mid-aged human beings, mainly women, which cause stress. Obesity, prediabetes, and type 2 diabetes mellitus are present among poorest people in mid and low economic countries. It is a cross-sectional study with a sample of 200 patients from Metabolic Syndrome Ambulatory, from 18 to 17 years old, prevalently middle-aged participants. They have mainly low income, between 2 and 4 minimal salaries, and minor or equal fundamental level of formal education prevalently. Fisher exact test and chi-square test were applied to statistic analysis. BMI I patients who reported aggressiveness in their appetite were different from those who did not indicate it, 17%. They showed a greater tendency to give up their diet when bored with their obesity, even though 33% had neuropathy and 44% retinopathy, followed by BMI III and BMI II. BMI III seems to be more affected in their appetite by hostility or aggressiveness. With hostility, 70% perceived their weight as minor than the real. With no hostility in their environments, 64% perceived their weight equal to the real. When focusing on verbal aggression, those who felt target of such type of aggression frequently felt more bored regarding their weight than others, and frequently bored regarding their disease, diet, and treatment than those who didn't refer to such aggression. There were not enough differences among patients regarding depression, anxiety, and alexithymia in the sample, considering body mass index and hostility at home, except BMI II, in which participants indicated anxiety with hostility at home and 61% did not mention hostility, 37%. It's not statistically significant. However, it's possible that this difference can be linked with such hostility. Aggressiveness in patients' home when reports also verbal social aggression, mainly among middle-aged patients, reduced the adherence to diet and treatment more than those who reported verbal social aggression outside their home, apparently affecting motivation to take care of their health.